Hello, and welcome to the new provider orientation for autism. My name is Shannon Guevara, and I am a behavioral provider relations representative here at Cigna. I look forward to spending the next 30 minutes or so talking with you all about working with Cigna. Cigna's mission is to improve the health, well-being, and sense of security of the people we serve. Because you play such a vital role in the health and well-being of our customers, it is a priority for us to develop long-lasting and productive relationships with you. My goal in this orientation is to give you the tools you need to start working with Cigna. As we move on, the Provider Services team is designed to be a one-stop shop in addressing your questions or concerns. Advocates can assist with eligibility and benefit quotes, claim status checks and problem resolution, provide basic information on initiatives that may be of interest to you, as well as serve as an initial point of contact. The Provider Relations team is dedicated to improving your experience working with Cigna. We're working with you, as well as behind the scenes, to make sure working with us is easier. Please contact your PR rep if you have questions about your contract or rates, or there's a question that the advocates on the Provider Services team cannot resolve. Before we get started, I want to let you know that all of the material I review today is from the Medical Management Program, our administrative guide. The MMP is incorporated into your Cigna contract by reference and gives you some information you'll need when working with Cigna. Now, let's start off by talking about the credentialing process. You are either in the middle of that process now or just completed it. Cigna verifies information with CAQH. Please respond to any request from Cigna regarding your profile. Once your CAQH profile is completed and has been attested to, it will be released to Cigna for review and final credentialing. The process can take anywhere from 45 to 60 days from the credentialing date. While in the credentialing process, you are only in network for patients with an HMO plan and integrated policies. Please call in to verify your in-network status. You will receive notification of upcoming credentialing at the mailing address we have on file for you, 6 months in advance of the re-credentialing date. Please note that in most states, re-credentialing occurs every 3 years. However, some states require re-credentialing every 2 years. As a contracted provider, you are considered in-network wherever you render services. Your contract with Cigna is specific to you rather than to a service location or taxpayer identification number. To help illustrate this point, if you are a contracted individual provider who also works for a non-contracted group practice, your services will be considered in-network regardless of service location or tax ID number. Review the Behavioral Medical Management Program at the Cigna for Healthcare Professionals website under Resources for more information. If there are changes to your clinic's address, telephone number, or leadership teams, please contact Provider Services as soon as possible. We will update your clinic's profile or amend your contract accordingly. Please note, address updates in CAQH are not sent to Cigna. You must contact Cigna directly with address changes. Call Provider Services at 800-926-2273 to add active service locations to your file. It is important to contact Cigna when you receive a new patient to verify their benefits. Benefits will vary based on their product type, among other factors. A provider advocate can confirm the correct claims payer for each new Cigna behavioral patient. This slide includes examples of some of the products Cigna offers. We currently don't offer Cigna HealthSpring in all states. Cigna HealthSpring Medicare, HMO, and PPO markets are not nationwide. Please refer to the MMP to see if HealthSpring is offered in your state. You can tell if you are in network for Cigna HealthSpring via your participating provider agreement with Cigna. You can outreach our HealthSpring service team for inquiries about HealthSpring Medicare and Medicaid plans. The HealthSpring service team can assist with claims or claims resolution, eligibility and status checks, billing inquiries, provide basic information on initiatives that may be of interest to you, as well as serve as an initial point of contact regarding HealthSpring. The Medical Management Program is an extension of your contract with Cigna. The MMP referenced in your participating provider agreement is divided in two sections, the administrative guide and the state-specific information. Examples of forms in the MMP are the primary care physician communication information, the self-pay agreement, and coordination of benefits. Access the MMP at cignaforhcp.com, resources, Behavioral Medical Management Program. I will now talk about the care advocacy processes. The initial patient procedures include making a copy of your patient's ID card, calling the telephone number on the back of the card to check eligibility or benefits, and confirming the claim address. You can also check eligibility, benefits, and claim status on cignaforhcp.com. The Autism Team is comprised of 13 full-time licensed clinicians dedicated to serving customers with an autism diagnosis. When an individual or family member contacts Cigna for assistance related to autism, they are assigned to an autism care manager who will assist by providing ongoing case management and by addressing questions and concerns related to autism benefits, treatments, and community supports. The Autism Team will also review any clinical requests for ABIT, or Autism Behavioral Intervention Therapies, including ABA. Please utilize the scheduling line to schedule an ABIT review or to determine coverage for ABIT. The Autism Team at Cigna provides the following services to customers who have a family member with an autism spectrum disorder. Find resources and offer referrals in your patient's geographic area, search for InNetwork autism healthcare providers, provide helpful information about treatment options, help the patient and their family learn about and make the most of their behavioral benefit plan, and help coordinate and integrate care between behavioral and medical benefits. If you call Cigna after hours, you will be directed to the scheduling voicemail and a care coordinator will return your call. Authorization is typically required for autism services prior to the service. The assigned care manager will review the benefits available under the identified patient's plan and any applicable state mandates. Some plans may not allow for ABA services. This is contingent upon state mandates and specific benefit plans. The assigned autism care manager will call your patient's family or caregiver within 48 business hours of your request to help assist them through the process. Remember that due to the requirements such as mental health parity, it is critical to contact us to confirm eligibility and benefits for every patient. It's also important to contact us at the beginning of each new benefit year for existing patients as benefits can change. The Autism Care Coordination Team assists with informing you of autism benefits information, authorizing functional behavioral assessments, and scheduling all clinical reviews. You have two options to request an assessment. Call the Autism Care Coordination Team at 877-279-7603 Monday through Friday from 7:30 a.m. to 5 p.m. Central Standard Time, or submit the Applied Behavioral Analysis Assessment Request Form. Remember, all plans may not allow for ABA services. This is contingent upon state mandates and the customer's benefit plan. Plans that do cover ABA require an autism spectrum diagnosis. All reviews are based on medical necessity criteria, and authorizations are dependent on state mandates and benefits plans. When requesting the initial ABA assessment, please have diagnosis information for the child, the name of the BCBA or independently licensed mental health care provider performing the assessment, the name of the standardized assessment tool you will be using, and the requested numbers of hours needed to complete the assessment. During the ABA assessment, the expectation is to perform the standardized assessment tool, gain information about diagnostic report, developmental history, any past diagnosis and treatment, and any psychosocial information. Please refer to the ABIT review outline on cignaforhcp.com. To submit a request for assessment, complete the assessment request form at cignaforhcp.com, Resources, Form Center, Behavioral Health Forms. This form should be completed by a provider who has a thorough knowledge of the patient's current clinical presentation and treatment history. You have two options to request prior authorization for ABA treatment. Call the Autism Care Coordination Team at 877-279-7603, Monday through Friday from 7:30 a.m. to 5 p.m. Central Standard Time, or submit the Applied Behavioral Analysis Prior Authorization Form. Please note, if you choose a live telephonic clinical review, it will take 20 to 50 minutes to complete. For live reviews, it is recommended to submit your treatment plan at least 24 hours in advance of the review. Clinical information gathered during the review include DSM diagnosis information, developmental history, psychosocial information, results obtained from the standardized assessment tool, current deficits and behavioral summary, current interventions and coordination, current medications, school services and coordination of care, additional outpatient services, past history of behavioral, educational, and medical interventions, treatment goals and progress, identifying treatment goals, interventions, and measurable outcomes, parent and family involvement in treatment, SPADE transition and/or discharge criteria, and current barriers to progress and how those barriers will be addressed. Please also include the amount of hours being requested in weekly or monthly amounts and the code information for billing. The name of the supervising provider and address which the authorization will be written to if authorization is granted is also requested. With the goal of saving you time on the phone, you can complete and submit an ABA prior authorization form, which replaces a live clinical review. Access this form at cignaforhcp.com, Resources, Form Center, Behavioral Health Forms, Applied Behavioral Analysis Prior Authorization Form. This form should be completed by a provider who has a thorough knowledge of the patient's current clinical presentation and treatment history. Cigna bases authorization determinations on the medical necessity criteria. Access to medical necessity criteria is at cignaforhcp.com, Resources, Coverage Policies, Medical and Administrative A to Z Index, Intensive Behavioral Interventions. Find additional autism information and resources by visiting Cigna.com and clicking the Health and Wellness tab, then Behavioral Awareness. You can then access the series All About Autism, which includes access to the Cigna Autism Specialty Team, articles relating to the autism spectrum, a free autism awareness series conducted over the phone that are available to customers and healthcare providers, and access to an FAQ. As the prevalence of autism increases, a growing number of our customers are in need of ABA services. Accordingly, timely access to outpatient care is more important than ever. To help remove barriers to care, we invite you to participate in Cigna Behavioral's ABA Fast Access Network. This network is made up of participating autism providers who guarantee routine appointments for first-time patients following the criteria below. Initial ABA assessment within 5 business days, create treatment plan and gather care team to begin first ABA direct treatment within 30 days, offer video-based telehealth services or willingness to implement capability within 1 year, collaborate with a patient's primary care provider or other medical providers, and if unavailable when a patient calls, guarantee return calls within 1 business day. If you would like to join the ABA Fast Access Network, please email specialtyoutreaches@cigna.com for the attestation form. Once you submit the completed attestation, your provider directory information on mycigna.com will be updated to include the ABA Fast Access Network designation for customer searches. By eliminating long wait times and delays, we can help avoid lack of treatment. Once you are fully contracted, we encourage you to register for our provider website. To verify your contract status, call Provider Services at 800-926-2273. Once registered, you can log in to cignaforhcp.com to verify patient benefit plans, check claim status, update your information, and much more. Next, we'll talk about attending website tutorials and resources so you can take full advantage of the digital solutions available to you. Providing you with a positive online experience is our priority. Visit the Behavioral Education and Training page at cignaforhcp.com to find tutorials and resources that can help you work more efficiently with Cigna. Learn to navigate the website, verify a patient's eligibility and benefits, perform claim status inquiries, register for electronic funds transfer and electronic data interchange, and more. All of the ABA CPT codes are in 15-minute increments. CPT codes 0359T to 0374T, with the exception of 0362T and 0373T, are no longer valid for dates of service on or after January 1st of 2019. All ABA services for dates of service on or after January 1st, 2019 must be billed with the new CPT codes 97151 through 97158, 0362T, and 0373T only. Only one provider can bill for a unit of time, with the exception of CPT codes 97153 and 97155. Getting paid is important. I want to take a few minutes to review some of the basics about claims submission. There is a detailed section of the MMP devoted to claims payment. In addition, there is an appendix with helpful claims forms. One important note about claims before we move on. A coordination of benefits form will be requested on the first claim of the year for all Cigna customers. While the customer is responsible for advising of secondary coverage, it will slow down your claim payment if they are unresponsive. You may want to ask your patients to fill out a coordination of benefits form in the beginning of every year for your records. If you have the signed form, you can submit it to Cigna to ensure your payment is not delayed. You can find a coordination of benefits form in the Appendix B of the Medical Management Program. Please be aware of the timely filing timeframes outlined within your contract. These vary state to state. Our self-pay agreement is available to use when services are rendered that are not covered by a customer's benefit plan. For clarification, the self-pay agreement is an agreement to be used when the customer is being charged for a service that Cigna does not cover, like missed appointments or writing of reports. There is a copy of the self-payment agreement in Appendix C of the MMP. You may use this form, or you're welcome to use your own as well. I want to point out a couple of common issues on the CMS 1500 form. In box 31, be sure to print your name as opposed to signing it. In box 31, be sure to only list licensed or certified healthcare providers, only one per form. Do not list out line therapy staff on form, as claims will deny. And also be sure that you are including your claims mailing address as it is listed on your W-9. These simple steps will help ensure that your claims are processed quickly. Required items on a CMS 1500 claim form include employee name, patient date of birth, identification number to facilitate accurate claims processing, type of service, date of service, charge for service, diagnosis, treating provider, taxpayer identification number of provider, clinic, or facility, provider signature, or national provider identifier required for electronic submissions only. Participating in electronic data interchange, or EDI, can help ease your administrative burden. Submitting claims electronically results in less claim processing errors. EDI vendors will allow you to receive electronic eligibility and benefits information. Working with an EDI vendor may reduce paperwork and generate faster claim delivery than traditional mail. It may also allow you to receive electronic remittance advice. EFT, or direct deposit, electronically deposits claim payments directly into your bank account. The benefits are they eliminate paper check mail delivery and handling, access funds on the same day of the deposit, which can increase efficiency and improve cash flow, view a separate remittance report online for each deposit, easily reconcile payments using a single remittance tracking number. Enroll in EFT and manage EFT accounts with multiple payers, including Cigna, using the Council for Affordable Quality Healthcare website. Enroll in EFT directly with Cigna by logging in to cignaforhcp.com, working with Cigna, enroll in electronic funds transfer options. A bi-monthly newsletter will be delivered right to your inbox to keep up to date with featured industry information, administrative updates, plan coverage, and helpful tips. On behalf of Cigna, thank you for your interest in our network and listening to our Autism New Provider Orientation. We hope you found the information valuable and it will help you to administer benefits for your patients with Cigna coverage. We also encourage you to refer to your Welcome to the Network email, which covers the highlights we discussed, including a link to the Autism Resource Guide, Cigna telephone numbers, email and mailing addresses, websites, and more. Thank you again.